This video will cover the structures, functions, injuries, and facts about the femur. The femur is the largest and longest bone in the body, and it has many functions. If need be, this would have been the best choice of weapon for our human ancestors to defend themselves against predators and foes. The large structures on the proximal and distal ends of this bone are helpful to understanding how this bone would articulate with the acetabulum of the pelvis. The proximal end of the bone is easily identified by the large protruding head of the femur. Because the head of the femur meets with the pelvis at the acetabulum, forming the hip joint, the head is not only proximal, but also medial. In this illustration, the acetabulum of the pelvis is represented here. On this side, the femur is seen articulating with the acetabulum of the pelvis. The easiest way to identify the anterior diaphysis from the posterior diaphysis is to look for the linea aspera, a large raised ridge on the posterior surface of the femur. The most prominent structure of the femur is the proximal head. An indentation called the fovea capitis can be seen on the head of the femur. The fovea capitis is important as it is the attachment point of the ligamentum teres. This ligament is thought to be relatively important in childhood, assisting with various forms of movement and in nourishment of the bone during early childhood, maintaining the integrity of the femoral head. Only a small amount of the femoral head is nourished by its arteries. In this illustration, the ligamentum teres is seen here, connecting to the fovea capitis of the femoral head. Moving distally down the femur, the next structure seen is the neck of the femur. This is the smallest portion of the bone in diameter. Below the neck of the femur are large mounds of bone, known as the greater and lesser trochanters. The greater trochanter is superior and larger compared to the lesser trochanter. The trochanters seem to be connected on the anterior and posterior sides of the bone by the intertrochanteric line or the intertrochanteric crest. On the anterior side of the bone is the intertrochanteric line, and located on the posterior surface is the intertrochanteric crest. The intertrochanteric crest is easily identified from the intertrochanteric line due to its visibly protruding surface on the proximal portion of the bone. The gluteal tuberosity is located on the upper posterior surface of the diaphysis of the femur. This tuberosity is nearly impossible to see on bones used in anatomy labs, as it has been worn away through the years by the wear of many students' fingers and is more prominent on new sets of plastic bones. The gluteal tuberosity continues down the shaft distally, becoming the linea aspera, the raised ridge on the posterior surface. At the distal end of the femur, directly above the medial and lateral condyles, are the medial and lateral epicondyles, epi meaning above. To locate the medial epicondyle, take a look at the proximal end of the bone and find the head of the femur. The head of the femur is medial, and therefore the medial epicondyle will be located on the same side as the head of the femur. These epicondyles serve as points of attachment for the ligaments of the knee. Directly below the epicondyles are the medial and lateral condyles. The head of the femur is medial, and the medial condyle is located on the same side as the head of the femur. On the opposite, or lateral side of the femur, is the lateral condyle. These two condyles articulate with the patella on the anterior side in the tibia below. The patellar surface is located between the two condyles on the anterior side and is where the patella would sit atop the femur. On the distal end of the posterior side of the femur, a large indentation, or fossa, can be seen between the two condyles. This is the intercondylar fossa, or notch. A few common injuries and diseases of the femur are of interest. Osteoporosis is a medical condition in which the bones become brittle and fragile from loss of tissue. Approximately 1.5 million fractures each year are caused by osteoporosis in the U.S. Of those 1.5 million fractures, 300,000 are fractured femurs. The U.S. has the highest rate of hip fractures in the world. In 2003, there were about 309,500 hospitalizations for hip fractures in the U.S. It is estimated that the number could exceed 500,000 by the year 2040. Women have a higher chance of having a hip fracture due to hormonal changes when estrogen levels decrease during menopause. This results in thinning of the bone and decreased bone density. Of the 300,000 people who are affected by this fracture, 10 to 20% die from complications and related illnesses within the first year of their injury. Of these, 50% are unable to return to unassisted living and 25% need long-term care. There are two different types of femoral fractures. A femoral neck fracture occurs 1 to 2 inches away from the ball and socket hip joint along the neck of the femur. The neck of the femur is the weakest area of the bone and becomes weaker with the onset of osteoporosis. This fracture can cause complications due to the cut-off circulation to the head of the femur. The second type of fracture is the intertrochanteric fracture. An intertrochanteric fracture occurs 3 to 4 inches from the ball and socket hip joint. This fracture does not interrupt blood from circulating throughout the bone and can be easier to repair. Well-known people that have suffered from fractures of the femur include Arnold Schwarzenegger and Ronald Reagan. Paget's disease of the bone is caused by the excessive breakdown and formation of bone, followed by disorganized bone remodeling. This causes the affected bone to weaken, resulting in pain, misshapen bones, fractures, and arthritis in the joints near the affected bones. Often, Paget's disease is localized to only a few bones in the body. The pelvis, femur, and lower lumbar vertebrae are the most commonly affected bones. Opposed to osteoporosis, which occurs in all of the bones, Paget's disease only affects one or a few bones. There is no cure for Paget's disease though medications such as calcitonin can help control the disorder and lessen pain and other symptoms. One well-known person that was thought to be affected by this disease was Beethoven. In this X-ray, the femur has a bow shape due to the patient's having a Paget's disease. As demonstrated in the video, the femur is a complex bone, and the body relies on it for vital daily activities, as well as attachment points for the ligaments of the knee. This video was prepared to fulfill a requirement of the 2014 Human Anatomy class at Saddleback College.